the same time of the advent of Islam, Europe, right? So here's the Muslim Empire, and right across the way, right across the oceans, you have Europe. Europe in that time very much was in the Dark Ages, right? Which is not the most historically accurate term, but certainly people use these terms, Golden Age, Dark Age, fairly commonly. And what it just means is it was a time in Europe in which science was not essentially ruling the way it is now. And it was also a time when you look at mental health specifically, there are so many examples of how the mentally ill were very much treated very poorly. And they were burned at the stake as though they were witches. And they were also, in some better cases, they were sent to like monasteries, to people who were the religious priests to be able to care for them, because people thought at that time this was purely a spiritual problem. But at the same exact time in history, you have the Muslim who understand that you can use rational sources, empirical sources, and still very much have Allah subhanahu wa ta'ala at the center. And therefore, in the treatments, the classifications, the diagnoses that they had, they also incorporated medicine. Like, here are herbal concoctions, medications that you can take for some of these illnesses, because they understood that there was a biological connection. They didn't have very advanced science of genetics yet, but they understood that there was definitely something heritable. Like, you can inherit things from one generation to another. They also understood you can take on things environmentally. So for example, if somebody lived all their life in a peaceful state, they're going to be just fine. But then one day, let's say war breaks out, and there's killing and bloodshed and all of this terrible stuff. And yeah, that person can go from being in a normal state emotionally to being someone who has experienced trauma. And that trauma can then affect them psychologically going forward. And what was the cause? It wasn't a genetic issue or a biological issue. It was an environmental issue of what happened in the environment they lived in, what they saw and witnessed, right? So they understood that. And they understood that some things can also be spiritual, but not only spiritual. And that's where the real differences between what the Muslims came up with versus what the people before them, like the Greeks and Romans, and certainly the people after them, like that very Eurocentric, very atheist, very scientific only understanding of psychology, very secular, very devoid of the spiritual sciences. So the Muslims had this holistic sense, and that's how they wrote. And when you look at the books and you look at the texts of the early Muslim scholars, you see very much that they talk about this. And you see when they classify illnesses and they classify treatments, they're talking about, here are some of the medications you can take for this condition. Here are some of the ways in which you would talk through this issue you're dealing with. So yes, they were some of the very first therapists in history, right? And thirdly, here are some spiritual ways in which you can get yourself to feel better as well. Not one, not two, but all three together. And that is the trademark of Islam. That is the trademark of Muslims. And Muslim science, the Muslim sciences, is that we have all of them working in harmony and in unison. And that works well for the modern Muslim too. This is not just a historical thing, but I want to show you how much this legacy of our Islam didn't just stay in the books, by the way. And that's the next part of our discussion. It didn't just stay in the books. Because some of you might be listening to this and saying, well, that's great, that's wonderful, wonderful books, great, excellent, alhamdulillah, we have this great history. But you see the differences, and this is what I say, the proof is in the pudding. If you want to see if they really understood holistic health, then the next thing would be like, you can write about it and theorize about it, but then you have to show me the evidence, show me the proof that this works. And so you know what the very first Muslims did? They built out whole healing institutions. In fact, so much so that till today, you can actually go visit some of these places, especially some of the ones that were built later in the Muslim history, that are still standing till today. In Arabic, we call these Dar al-Shifa, or the house of healing, or institutions of healing. In Farsi, they call this Bimaristan, right? Same meaning. And this concept of having healing institutions are essentially the first hospital systems. And the Islamic hospital system is also different than the typical hospital system. And what's so beautiful in terms of psychology and psychiatry now is that there were other places in the world that had hospitals, right? That's not a new thing. But what was new and different, and as far as we can know, or as far as we know so far at least, that the Muslims were the very first to have a psychiatric ward in that hospital system. And over years and time, they then started to build standalone psychiatric institutions that were just for the purpose of healing those with mental health conditions. And I'm going to go through some of the details of like how phenomenal